Hi there. You can consider this the non-medical related part of the presentation. I will not use any slides, nor graphs, nor other things that I only try to understand. Thank you for having us here. It's nice to see a number of former and current colleagues in the room. I know some of you from my previous gig. I was the Executive Director of Community, BC's Queer Resource Centre. I'm currently the Executive Director of Options for Sexual Health. We're the largest provider of sexual and reproductive health care, nonprofit provider of sexual and reproductive health care in Canada with 60 clinics around the province. But I'm really here to speak to you in my capacity as a queer rights activist. I would say all my adult life I've identified as a queer rights activist. Most of my adult life, I had also identified myself as a blood donor, and that was something that came to me quite naturally. My father has been a blood donor almost all his adult life, and he instilled in me the importance of giving to our communities, and blood donations was part of that. So as soon as I was old enough, I became a blood donor myself, and I was proud to give blood for years. And then, at some point along the way, I became aware of the blood ban policy that Canadian Blood Services had. Realized that my gay brothers couldn't give blood. And I realized the discriminatory effects of that ban. That didn't jibe with my queer rights activism. So I stopped giving blood. I don't know exactly when, but a number of years ago. It was something I missed. It was something that had felt really important to me. I've always been guided by a principle of making a difference, and giving blood felt like part of one of my values. But so did standing with my queer brothers. They couldn't give blood. They were being discriminated against. I wasn't going to give blood. Through the course of my activism, and then through my job at Community, I spoke out against the blood ban. In fact, I took every opportunity I could to speak out against the blood ban. If there was a microphone in front of me and I was given the opportunity, I would talk about how Canadian Blood Services was discriminating against the queer community and what that meant to us. It was something that I felt passionate about. It was something that felt very important, a wrong that needed to be righted. So because of that, when I was invited by Canadian Blood Services to take part in consultations in 2011 and 2012, I jumped on it. It felt like, great, this is my opportunity to go to Ottawa and give them hell. They're doing something wrong and they need to hear about it. Well, they'd been hearing about it from a lot of people for a long time. But that was the rallying cry I took with me to Ottawa, and sat in this room with, the original consultations I took part in were just representatives of the queer community, and we sat there and gave folks from CBS what for. And we also asked a lot of questions. Folks at CBS were wonderful, to be frank. It wasn't really the reception that this fist shaking in the air activist expected. I got a heck of an education. I learned a lot. I learned a lot from my fellow queer community activists and from the folks at CBS. I learned even more about the effects of the ban on folks across the country, and learned about things that Margaret and Dawn have told you about testing technologies, about the changes that have come about in the technology through the years. Learned that it wasn't Canadian Blood Services that was saying, we don't want gay men's blood. That the ones that set that rule, the ones that really were keeping the door closed, was Health Canada. You've heard Margaret refer to Health Canada as being a conservative regulator. Do we need to say more with this current government? Okay, but that's been the case under previous governments as well. The folks that I got to know at Canadian Blood Services, the folks that were in the room with us, Margaret and her colleagues in Medical Science Division and throughout, they want to change. They want more people giving blood. They want people like me to get back engaged and giving blood again. And folks like you, when they're able to test adequately, to know that the blood is safe, they want you back in as well. It's not Canadian Blood Services that is holding that door closed. It was the regulator. This was news to me. I didn't realize that. Turns out I'd been shaking my fist at the wrong people. So we had these great consultations, queer community representatives, meeting with CBS folks, and then at the same time, stakeholders, patient group representatives were also meeting with CBS. They then brought us back together again in Ottawa and put us all in the same room. Queer community representatives, patient groups representatives, and again the same experts at CBS. Continued the education, continued asking the questions, and spent time getting to know each other and hearing what each other's concerns were around the current the policy of the day, the lifetime ban. Those of us within the queer community were able to cite our concerns quite emphatically and quite passionately about the discriminatory effects, about how many of us wanted to be giving blood. We wanted that sense of feeling like we're making a difference. And we heard about the fear, the quite well-founded fear of the patient group representatives. We spent a lot of time sharing and learning about each other's circumstances. It was a very moving experience for all of us in the room. It was through those consultations that, as Dawn mentioned, CBS was able to gather letters of support. Those of us from both groups came together, and although Dawn said we were originally at different parts of the spectrum, you know, we were being told we had an opportunity to support a change in policy of between 5 and 10 years, and I went in the room saying any type of ban of this kind isn't acceptable to me, as did many of my colleagues. Were saying 5 years, we don't accept that. We learned more about the testing. We learned about this 10-day window. It's like, okay, fine. Well, then shouldn't it be a 10-day window, 10-day policy? We learned about why that's not feasible at this time, and again, that it's the regulator that's the one saying, not yet. Take this slow. Gather the data. Persuade us. Convince us. So we got to a place where, for many of us, it was, this is not our ideal. We don't want a 5-year ban. We want, our end goal is a gender-neutral, behavior-based survey, so that when someone goes in to give blood, they get that raft of questions that Margaret showed you, and included in that would be questions about your activities, so that the decision as to whether your blood is safe or not would be based on whether your behaviors, whether your activities you've engaged in might have threatened the safety of your blood. Questions like are already there about whether you've handled monkeys. I don't know if anyone in the room has handled monkeys, but that would rule you out, just so you know. That type of a survey, to me, speaks to what is the real threat. The threat is not who you are and who you love. The threat is about how you perform an activity, and does that activity threaten the integrity of your blood, the safety of your blood. So that, for me, is the end goal. That's where I hope we're getting. But we weren't being offered that as an option. Health Canada wouldn't have accepted that. We were told that the best they would accept or even consider is a 5-year ban. So I see this as incremental progress. And in fact, when Health Canada came back accepting the submission, they gave a number of conditions that they put on Canadian Blood Services, that you can do this, but you need to do the following things while you're doing it. You need to collect all this data demonstrating the blood supply is still safe. You need to show us that it brought more young people into your clinics. Young people have been, I think, some of the biggest sector of the population that stopped donating or never started. And in part, it's because of some very effective campaign that's been going on the university campuses. What we're trying to do is help folks understand things are changing. Please re-engage. And we need those young people to get in and give blood. So Health Canada said, show us young people are engaging. Show us young people are coming and donating. And some other conditions I can't recall at the moment. But there were these conditions. CBS has to report back within a certain period of time, show all this data, very persuasive data, before CBS can submit another proposal to change the ban again. So we're in this for the long haul. And personally, I'm in this for the long haul. After those consultations, I was asked to be part of a working group, the MSM Policy Working Group at Canadian Blood Services, and in fact, I'm one of the co-chairs of the group. And it's something I'm proud to be doing. Feels very important to be working towards change. And around the same time as we heard that, or shortly after we heard that Health Canada accepted the submission to change the policy, and around the same time as CBS started with the new policy, I decided it was time for me to reinvigorate my commitment to giving blood. And I'm now a regular blood donor again. I've given 4 donations since stepping back into a clinic, and I feel good about that. I couldn't have felt good about it in the intervening years because it felt like I would have been perpetuating something that discriminated against people I care about. I've now been active in trying to work towards a change for those people I care about, for the men who have sex with men. And I know we're working towards a goal where hopefully more of members of my community will also be able to join in what I feel is a civic good to make a difference, to give blood. That's why I'm committed to working with CBS. So I'm happy to say I'm proud to be a blood donor again, and I'm proud to be working with Canadian Blood Services towards a change that will include all of us in a much more inclusive way. So thank you very much.